Stigma occurs when somebody labels another person and sets them apart as unwanted. And stigma is a process of harming the character of a person in the eyes of others. And underline the harming part and the character part. It is the shame or disgrace attached to something regarded as socially unacceptable. And underline regarded because it's being regarded in the person that's stigmatizing's view. And then it is a false perception and judgment about someone as a result of a condition. For example, with disability. For example, TB. For example, HIV. And any other ailment. That's the definition of stigma. But there's a difference and there's a thin line between stigma and discrimination. So what is discrimination? So discrimination occurs when a distinction is made against a person on the basis of known. That's number one. Known or suspected condition or status resulting in that person being unfairly treated. That's discrimination. It's a distinction made against a person that results in their being treated unfairly or unjustly because they have a certain condition. Sisonke, siyayizolenda. It's treating someone differently due to their condition. That's discrimination. It's being denied opportunities and access to services on the basis of your condition, status, or even your job. Are we there? So it also refers to the physical manifestation of negative attitudes and beliefs. For example, rejection from community, shunning or isolating someone. Do you know at times you can be in a church and you can be isolated? That's discriminating. That's discrimination and that's not stigma. A distinction made against a person that results in their being treated unfairly or unjustly because they have HIV or they are HIV positive or they have TB or a disability or even poverty. Because you are poor, you then are discriminated against. So don't worry about writing, you'll get these handouts. So the thin line then between stigma and discrimination then comes with the perception and the behavior. The 2014 Stigma Index that was done in Zimbabwe revealed the following statistics. 65.5% experienced one or more forms of HIV-related stigma and discrimination in Zimbabwe. 31.2% verbally insulted, harassed, and or threatened someone with a condition. 21% felt excluded from church and social gatherings. Are we there, church? 21% of those that had conditions, HIV or disabled, because it was focusing on those three tenets. 21% felt excluded from church and social gatherings. And at this point, can you ask yourself that, were you not one of those that caused the exclusion or social exclusion within the church? 19% physically harassed and or threatened because of their condition. 15% were discriminated by partners. Because you are now all of a sudden disabled, so now you are discriminated against. You are positive, HIV positive, and you are discriminated against. You are battling with TB, and by your partner. 13.1% had to change or they were denied accommodation because of a condition. And this is here in Zimbabwe in 24. This was done in 2014, because you might think these figures are from somewhere else. 12.4% had psychological pressure, so they suffered from psychosocial challenges. 12.1% were denied work opportunities due to their status. And I'm reminding you that we are in the church, and this is the percentage that was affected within the church environment. There are different types of stigma and discrimination, and I'll start with internal stigma. So internal or self-stigma in discrimination, this is shame that is felt by an individual after receiving the negative responses and reactions from others, or by believing that they are to blame for being like that. So there is some internal low self-esteem that then starts to happen to you when you realize that some people are shaming you or they are looking down upon you. And that's self-stigma. Because it's happening to you because you realize that there are people who are not talking about it, but who are behaving and demonstrating that they are stigmatizing you. You start to have self-stigma. Then ultimately you have low self-esteem. Then there is external stigma and discrimination. This is perpetuated by others, and you can see it point blank, that these people are discriminating against me because of my status or because of my condition. And people are pretending to like me when in fact they don't. There are quite a number of signs of internal stigma and discrimination, and self-stigma or internal stigma is one of the most dangerous because it really doesn't come out even when you then get an interface with a counselor or someone who can provide psychosocial support. It's difficult to notice until you open up. And self-stigma is really a dangerous stigma because it lowers your status and you feel you have a lowered status. And when you have a lowered status, you have lowered IQ. And if you have lowered IQ, you then are antisocial. And if you are antisocial, you then fall into trouble and you don't have a help-seeking behavior. And if you don't have a help-seeking behavior, you equally don't have a health-seeking behavior. And if you don't have a health-seeking behavior, you then quickly fall ill because your immune system is compromised. And if your immune system is compromised, you cannot work, and then you have poverty. Do you see the cycle? So, and how do we identify or do we see the signs of internal stigma and discrimination? It's loss of self-esteem. And remember the chain I talked about, right? That's where it starts. Loss of self-esteem. So when you're walking tall, you're no longer walking tall, right? When you're walking with your chest out, you're no longer walking with your chest out. When you felt you were beautiful as a lady, you no longer feel you were beautiful. That's loss of self-esteem. When you're walking with your hands in your pocket, you feel you want to walk in a different way. You have lost your self-esteem. This then leads to depression. You feel depressed. This then also leads to some kind of guilt or a sense of blaming others. You then start to apportion blame rather than look internally, rather than introspect and say to yourself, what is it that I'm supposed to be doing? It's characterized by lack of confidence, inferiority complex, self-isolation, and dejection. Thoughts and feelings of wanting to end on life. So suicidal tendencies, that's when they come into the picture. Remember yesterday I gave you statistics around suicides in Zimbabwe, and they're still there. Delay or avoiding seeking treatment for fear of being identified as being either HIV positive or you have TB or any other condition. And I wanted to give a diary after asking people how many people have been tested for HIV in the last 3 months. So these are some of the signs that you really feel in your head, because self-stigma, it happens within your brains. It happens within yourself. So it's something that happens internally. And you feel as you're walking that I'm inferior. You say to yourself, I'm inferior. You tell yourself that this should be a punishment from God. Suppose something has happened to you and all of a sudden, maybe you have a condition. And you think, no, this is a punishment from God. You start thinking backwards. You say to yourself, I can't touch other people because of this condition. You tell yourself that I cannot handle this condition, or I cannot handle myself because I've lost self-esteem. You continue to say to yourself, I feel unclean. You tell yourself that I'm useless. You tell yourself that you're toxic and you cannot interact with others. You tell yourself that you have no one to talk to. This is self-stigma. You tell yourself that you're a terrible mother. You feel bad. You tell yourself that you don't deserve to be loved. I can't use the same utensil in the house because of the other person who's positive, who's got a condition. You feel you're like you are isolated, you are alone. So you tell yourself that I'm alone in this world. And you tell yourself that you're dangerous. You think you are smelly. You think, you are ashamed of yourself. You feel you're a burden to others. You feel, I won't get the job, so I'm useless. I'm less human than everyone else. I'm dirty. I'm less of a person. I'm less than anything else, and I feel unclean. This is self-stigma. Have you felt this way before? These are some of the thoughts that come into a picture when something happens. But how does it limit a person? Still self-stigma. You can't enjoy life. Right? You can't work. You can't see your children graduate because you have self-stigma, so you then realize that you are slowly catalyzing your death. You feel you can't succeed. You feel you can't have more children. You feel you can't have friends. You can't plan for the future. You can't change your status. You can't go overseas. You can't talk about medication, and so many can'ts. And yet, you can. So what are the signs of external stigma? Remember, I was talking about self-stigma. So for those that are not suffering from self-stigma, there is also external stigma. But what are the signs of external stigma? Social isolation and mockery within the work environment. That can be the starting point. Because most of those that are working, they spend most of their time at work. So because you spend most of your time at work, that's where you can start to see stigma and discrimination at work. Termination or refusal of employment also happens or comes into the picture. Remember when I talked about the cost that comes with TB, for instance, loss of employment can also come with TB, because suppose you have MDR TB, you end up being isolated for a longer period and automatically you lose your employment. And as a result, that then becomes stigmatizing. Previously, other signs of external stigma and discrimination, they are not just from individuals, they are equally from policies as well as acts. Currently, in Zimbabwe, the Education Bill is trying to amend a portion where if a girl child falls pregnant, that girl child was being chased away from school. Isn't that stigma and discrimination? But the boy would remain in school. But that is as a result of a policy. So a policy can also stigmatize. Denial of promotion or staff development opportunities can be a sign of external stigma. Exclusion, rejection, verbal and physical abuse is equally a sign of external stigma and discrimination. Being forced to relocate or change schools or even change the church is a demonstration of external stigma and discrimination. And the person feels, no, I think I'm more comfortable going to Windsor Park Church. I'm moving from city center. And why? Because of stigma and discrimination. In extreme cases, even acts of murder and violence because of stigma and discrimination. And what comes into mind? Xenophobia. That's stigma and discrimination. Prevention of having access to visitors or treatment. Avoiding rejecting TB patients or people living with HIV. Denial of visa or entry into a country. Of late, did you see the advert that was being flighted for scholarships to Russia? Did you read those adverts? What discriminatory clause was there?
You must know Russian language.
No. There was a discriminatory clause, yes, ma'am. Exactly. And isn't that discriminatory? So you are denied entry into another country because of your status. That's stigma and discriminating. Deportation of expatriates with HIV, and even in China, the same the same thing that we're talking about. Even in China, if my child is there in China, he's studying in China. When you went there, they wanted medicals. So you do medicals, and you are supposed not to be HIV positive. You're not supposed to have TB. And when you go there, they do confirmatory medical tests. And if they find that you are positive or you have TB, you come back, you're deported. And regularly, they then continue to have, every semester, they have to have medicals, and you pay for those medicals. Isn't that stigma and discrimination? Deportation of expatriates. So it's the same thing. If those students are found with HIV or TB, they're deported. Denial of life and insurance policies. That's stigma and discrimination. Inappropriate terminology and metaphors. Right? And you know quite a number of these. AIDS sufferers, HIV victims, varimushirongwa, red robot, fovanama kotri, and all that. That's discriminatory language. And we also had discriminatory sign language. But what are the causes of stigma and discrimination? Number one, dominant transmission routes. Fear of contagion. That fear, lack of knowledge, imparts fear in individuals. If you don't know how TB is transmitted, and then you think every person who's on TB medicines can transmit. So that fear can then be a cause of stigma and discrimination, and yet it's not true. Once the person starts treatment, then they are no longer transmitting. Religion also comes in as a perpetrator, as a cause of stigma and discriminating, where instead of us counseling, we look at someone maybe who's positive to have had sexual immorality. And yet, that's not. Gender disparities. Women with HIV or TB are usually treated differently from men with similar conditions. Have you ever realized that? And why is that? It's because of gender norms. Tomorrow we'll talk about gender-based violence, but you actually see when we present on gender-based violence that men are actually more gender stigmatized than women. Did you know that? And wait until we talk about that and we discuss tomorrow. Inaccurate information about how disability, TB and HIV happens or is transmitted, which creates irrational behavior and misperceptions or misconceptions of personal risk. Negative media reporting, language, images portrayed, and advertisements, e.g. images used such as skeletons. HIV is associated with social unaccepted behaviors, and yet it's not always true, such as irresponsibility, prostitution, promiscuity. These behaviors are already stigmatized in many societies. So the minute we connect, right, HIV and those social unaccepted behaviors, then we stigmatize based on that. And yet there's need to separate the two. Most people become infected with HIV through sex, but sexually transmitted diseases are always highly stigmatized. But on the other hand, do you realize that in today's world, TB is much more stigmatized than HIV? And yet TB is curable. Why? It's because we have done so much education, awareness raising around stigma related to HIV. But we haven't done the same with TB-related stigma. And it's the responsibility of the church to continue to share the message, and ourselves when we go back to our churches and communities. But what are the effects of stigma and discrimination? Individuals become reluctant to access TB screening, for instance, HIV testing, for instance, treatment and care. Just last week I was asking someone, and I was saying, so when was the last time you were tested? And she said, no, I'm almost 50, and I'm not going to remarry. I'm already old. There's no need. And then I laughed and I said, this is stigma. This is self-stigma, right? Because there's that reluctancy to accept the results, right? So that fear of the unknown, to then say, so what will happen to me? So the complications, the effects of stigma and discrimination complicates decisions about TB and HIV disclosure. And equally, for you then to start medication, because already you have complications in terms of disclosure, then it becomes difficult for you to start medication, and you then say you want to go to a clinic that's very far away so that no one sees you getting your medication. And the reason why, I can tell you, pharmacies in Francistown have more people from Zimbabwe coming to buy their medication in South Africa, and yet it's free in Zimbabwe. But they're going to buy medication in Francistown and carrying all those expenses. Why? Because of stigma and discrimination. So you see the cost that's also related to stigma and discrimination. The effects of stigma and discrimination makes it difficult for an ill person to come to terms and to manage the illness because of stigma and discrimination. You then, it's difficult for you to come to terms to say, so this is really me. This is really the problem. I'm carrying this. Loss of marriage and childbearing options are equally other effects of stigma and discrimination. Committing suicide, especially teenagers, and the higher numbers of HIV-related deaths. So with this, in this day and age, because of research and development, people are not supposed to be dying of HIV, right? And of late, research and development, we now have the latest medicines, they call DTG, right, or TLD, and less efficacious, very good, and they don't have any side effects, and they are coming into the country. And it's important that we then should inform our colleagues, inform our partners, inform everyone else that if HIV and TB, they have a solution, so why should you stigmatize yourself? Decisions and choices are thwarted. So the plans that you would have had, you stop those plans because you think, remember the self-stigma, you think you are no longer important. You think you cannot plan for the future. Just last week, a person that's living with HIV, the first person he turned 100 years just last week. The first person to disclose his status. He turned 100 just last week, and he was celebrating. And he's still alive. He's still good. He's healthy. So decisions and choices are thwarted because you think that your life has been shortened, and yet medicines are available that are life-prolonging. There are limited chances for behavior change. Those are the effects. You feel there are limited chances for you to change your behavior. Withdrawal of caregiving in the home starts to also happen. Women fear violence, rejection, and abandonment. To then say, if I then go and present, have tests, and then if I'm found to be positive, and then I come back home and I tell my husband that I'm HIV positive, then violence will start in the home. And when we talk about gender-based violence, we also talk about sexual gender-based violence. And at times, it also starts. So you'll find in a home, you might find the men taking medicines, but the wife doesn't know that the man is taking medicines, and the wife is equally taking medicines, and the man doesn't know that the wife is taking medicines. But why? Are there such things that are happening? But why? It's stigma and discrimination. And people, the effects of the stigma, people have been dismissed from work. Some drop out of their church, the social circles, they sacrifice their education and sometimes their professional pursuits because of stigma and discrimination. But fortunately, stigma and discrimination can be overcome. So there are quite a number of areas where we can, or things that we can use to overcome stigma and discrimination. We can all overcome stigma and discrimination by being more accepting of others. That's love. And taking some of the following actions. Meet the health needs of people living with TB, HIV, beyond HIV treatment. Even the co-infections, even the non-communicable diseases, even those that are affected by other sexual reproductive health-related diseases, by providing spiritual and psychosocial support. And it's easy for the church to do that, to provide spiritual and psychosocial support. Do you know just visiting someone and singing powerful songs can provide that spiritual and psychosocial support? She talked about just spending a night with a family that had challenges was adequate psychosocial support. Link the TB, HIV, NCD response with the church and the social protection programs. We need to ensure that we integrate all those with our church programs to help ensure that people affected and infected continue to be healthy and productive members, not only of the society, but of the church in their communities. And this is one such powerful way of integration, having such a health convention, because at least it actually brings us back to realities. These realities are within us. These realities are living in us. And we need to stop stigma and discrimination. And we need to start from the church. Support programs, policies, and laws that create shared responsibilities among everyone in their role to prevent new HIV infections, irrespective of the status. We need to remove policies and service practices that hinder access to means of prevention for people living with HIV, including the prevention of vertical transmission. We all have a role in our different workspaces to change policies. We all have an opportunity to push our parliamentarians and our lawmakers to change policies for the better. So we have to do that, and we need to do that. But at the same time, there are other practices. Some of them, they're traditional. Some of them are religious practices, not within our religion. But you'd find there are others that continue to deliver at home. Home deliveries are still happening because of religion. There are certain ultra-conservative and conservative churches that still do home deliveries because they don't have a policy of visiting clinics. They don't have a health-seeking behavior as a church, so they do home deliveries. Scale up access to TB and antiretroviral treatment for all people living with HIV, including key populations living with HIV, who often face the greatest barriers to services, utilizing the preventive benefits of treatment without compromising their human rights. Because remember, every human being has human rights, and they have the right to life. Empower people living with HIV to know their rights and engage meaningfully in all aspects of the response to HIV. That's within the context of HIV. Provide correct information to educate people about how HIV, even including TB, is transmitted. But we also need to establish a support mechanism or support systems for the ill. So this is across all the different ailments. Because remember, if we don't provide psychosocial support or spiritual support, those that are ill will continue to be ill. So we need to establish a support system within the church to ensure that we have a way in our busy schedules to support the ill. Strengthen counseling to help people deal with their fear about TB, about non-communicable diseases, about HIV, about even disability, in like our friends were doing today. Promote meaningful involvement of people living with any disease, and especially HIV, in church programs. So that peer-to-peer, that sharing of experience then brings practicality and reality to the disease. And then that stigma and discrimination tends then to fade away. Create open discussions around attitudes and values which influence stigma and discrimination. Because discrimination is as a result of our attitudes and our behaviors. And stigma is as a result of our the actions. But what is the impact of stigma on the prevention as well as the continuum of care cascade? And this diagrammatic illustration is based on McNeil and Anderson theory of managing stigma and discrimination, where I spoke to a bit of this, where low perception of individual risk initiates the process, and then it affects the prevention modalities or prevention mechanism. So you realize that there is low perception, but because there is low perception, then prevention mechanisms are then eroded. But because there are low perceptions, then prevention will aid the identification of the serostatus. But at the same time, because there is limited care and support, maybe because there is denial of appropriate health care, or there is no care-seeking behavior due to fears of public recognition and status. What I was talking about, where people end up going very far to access their medication because of this. So as a result, because they don't want to identify with their serostatus, they want to go very far away. But the minute they fail to have enough money, or they have a barrier that prohibits them to get to Botswana, for instance, or Francistown, then they start to have drug-resistant challenges or antimicrobial resistance because of this fear that I'll be seen by someone else. So public recognition of my status. So that then affects the care and support, because you cannot get care and support if you're not open. So someone else cannot come and counsel you or help you or assist in any way if you are not open or if you're not disclosing. So that then affects us, because stigmatization of associated behaviors then limits the effectiveness of any harm reduction intervention. As I conclude, Ban Ki-moon actually said this quote: "Stigma remains the single most important barrier to public action. It is the main reason why too many people are afraid to see a doctor to determine whether they have the disease or to seek treatment if so." I remember when the doctor said, "My doctor told me this," I had quite a number of undertones, people asking, so the doctor has another doctor, right? So that's a health-seeking behavior. But the challenge is, remember earlier on I said men have a low health-seeking behavior. Men will say, no matter how much pain, they'll say, no, I'll drink water, I'll do this, I'll do that. It's only when they are on the bed that then they will accept to go to the hospital or to see a doctor. Why? So it is the main reason why too many people are afraid to see a doctor to determine whether they have the disease or to seek treatment if so. It helps make TB and AIDS the silent killer and become silent. Because people fear the social disgrace of speaking about it or taking easily available precautions. Stigma is the chief reason why the TB and AIDS epidemic continues to devastate societies around the world. And this was said by the UN Secretary General Ban Ki-moon. But as I leave today, the food for thought is, I'm committed to reduce all forms of stigma and discrimination. And he also committed to reduce all forms of stigma and discrimination. How about you? Thank you.
What does the church say? Amen.